Okay, bowel control. So we've already talked about if you're having trouble with releasing poop. This is for someone who is having increased ease of releasing poop. So if you even let go of gas accidentally and you didn't know that you even had that, or if you don't even know that you have the urge to go and then you go to the bathroom and there's staining on your underwear, or you wipe and you're like, I didn't know that anything even escaped me. This is for you. I do want to say that sometimes the way that the anus is anatomically positioned may allow things to leak out afterwards, just because, like in the last video, if you haven't been pushing everything back up, uh, and the has been sitting down and descended, and then so poop is still able to just like halfway get out, that actually continuing to push things back up very gently, very, very, very gently. I'm not saying poke and be mean or aggressive, just encourage organs and tissue that should be inside of you to remain inside of you. And in the meantime, the strengthening of the pelvic floor organs will, instead of having this like frail paper thin organ muscle layer between the organs and the outside of your body, you'll have this big, thick, beautiful, healthy tissue to also help support and keep things up inside you that are supposed to stay up inside you. So I'm going to share my screen and talk about control. So a lot of the same stuff that we talked about for constipation is also still very, very relevant for an inability to control the urge to go to the restroom. I do want to remind you that if you have been in a position, I treat a lot of people that are finally retired. And so for 30 years, they did not get to listen to their bowels. They woke up, they went to work, they were a teacher, they couldn't poop whenever they wanted to, and all of a sudden they get the urge, they're like, nope, not inappropriate, nope, inappropriate, nope, inappropriate. If you continue to do that, you actually lose the urge to go to the bathroom. So I want you first to pay attention to when and if you get that urge to go to the bathroom, maybe go. Like, novel idea, I like that. Like, let's use the things that your body already has going for you and use it to your advantage. So choose the best time of day to have a bowel movement. Usually the best time of day is a half hour after breakfast. For some people, the half hour after breakfast or lunch will work even better. Their system naturally works a little bit later. I do want to point out that when we're sleeping, rest digest is happening. So you finish eating, drinking, you go to sleep. During that time, your body shifts its entire blood supply to your organs to start really, really working on digesting all your food, which is another reason why it's really great to have a bowel movement in the morning. Then we have a gastrocolic reflex, which is the stimulation of needing to use the bowels, which begins with eating. So producing a bowel movement right then. So after I learned all of this, I have, and my mornings are crazy. Your mornings are crazy. I wake up, I got to get dressed, I got to get the kids ready. And then I got to drive an hour to get to work. Like I wake up at 4 and I don't even see a patient till 8. Like I have a lot to do in that amount of time. And if I don't take the time to go to the bathroom, I won't. And I need it to happen before the kids wake up, because once the kids wake up, they take my time. So I wake up, I drink a glass of water, room temperature, one of those Tervises size, like next to the sink in the bathroom. Room temperature water, start that gastrocolic reflex. Make sure you're not rushed and you have a convenient access to your bathroom at the selected time. For example, if I chose 15 minutes after we woke up to use the restroom, it's a bad time because my husband's in the bathroom. So, you want it to be convenient. You don't want it to be when you're going to keep pushing that urge to go. So eat all your meals at a predictable time of day. The bowel functions best when food is introduced at the same regular intervals. So I already said that earlier when we talked about diet. Consistency is key coming in, so you can have some consistency going out. The amount of food if given each time should be about the same size. You can eat different things, but I wouldn't have banana for weeks and months, and then all of a sudden throw something else crazy at it. It's going to change up your system a little bit. So it is fine to have a small breakfast and a large lunch, but just be consistent. So they suggest 2 servings of fruit or vegetables and a complex carbohydrate at each meal, which is, most diets is the same way. But again, I'm not going to go much into diet. There are other people to do that. Drink plenty of water, 8 glasses a day. Very, very consistent. I'll remind you again that if you don't get enough water in your system orally, it will start taking it out of your colon. So if you're not having consistency of going to the bathroom, you can have 2 to 3 dried prunes each night to stimulate a bowel function in the morning. So I travel with prunes. I keep them in my purse. We went on a trip recently, and it was very interesting because I had prunes in my purse on my little thing. I didn't eat them on the plane, but I knew that I woke up at 3 in the morning, didn't go. Our flight was at 6. And so I wanted to make sure that as soon as we got to where we're going, I was going to start eating some prunes. So that way I don't skip a whole 2 days. So exercise daily. Like I've mentioned before, consistency is key, and our body was made to move. We are in a I'm a physical therapist. You would think like, oh, you're so active. No, I sit and I talk with people, and I touch organs on the inside of their body. Muscles on the inside of their body potentially all day. So for 8 hours, I'm not active. So I do have to carve this time out. And it is a struggle for me, myself, and everybody that I treat. So you may find the bowel function is helped most if the exercise is a consistent time of day. Okay, so consistency is key. Hope we learned that. So control techniques, learning to control urge and bowel movements. If you're experiencing some type of incontinence or leaking bowels, knowing what the urge feels like is going to be huge. If you're having 2 or 3 bowel movement in quick succession in the morning, you maybe eventually be able to hold on to the first ones, so that way you're able to have one larger bowel movement all at one time. I also want to remind you, and I'll go over in another lecture about a rectocele. So you may have some success with holding on, and then be more confident. I would love that. And then have less urgency, because that urgency feeling is no fun. And the less you panic, the easier it is to make the urge go away. So resisting the urge. So you get that first urge, go to the bathroom. You're tired of having 3 or 4 poops in the morning. So you're actually, I like to think about doing this quick contractions. So doing quick contractions, 5 quick ones, boom, 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 is a reflex that's sending signals, like a patellar reflex, like you hit someone's knee, boom, it sends a signal up to their brain. The brain sends a signal back down to the bladder and the bowels, which are smooth muscles, to stay holding the stuff that they're holding. You can use it for gas as well. So the first time that I got this piece of paper, paid for all of these handouts, they said to try to sit on the toilet and don't go for 1 minute. If you are coming to see me, then holding on for 1 minute while sitting on the toilet after you just ran to get there is going to be really, really hard. So I've changed my handout to holding it for 10 seconds before actually going to the bathroom. And I want to remind you that this reflex, RAIR, the rare reflex, I have to think what that stands for. It takes 45 to 60 seconds to retrain this strong urge. So as we're working on pelvic floor strengthening, someone will think like, oh, we're going to have to hold this thing for 45 to 60 seconds. No, I'm going to have you do other things that also engage your pelvic floor, like walking uphill or carrying a heavy thing or doing leg exercises, but I'll have people hold it for 45 to 90 seconds, like while they're strengthening, so that way they can retrain this urge. And it wasn't so like just plain Kegling. I can't Kegel. It's hard to Kegel past 8 seconds. I am already thinking of what I owe at what I need at the grocery store. Um, it is hard to retrain that and hold that for that long. Recto-anal inhibitory reflex. So recto-anal, it's rectum, anal inhibitory reflex, RAIR, is the 45 to 60 seconds. So gradually you can increase this to 2 minutes. Don't worry if you're not able to do this the first couple times. Just keep practicing. So every time you go to the bathroom, I want you to sit on the toilet and don't go immediately. I also want to stress out, I'm going to jump ahead to the bottom of this page. These techniques are if you are only experiencing incontinence. So if you are suffering from constipation and you're not leaking bowels, then I want you to actually listen to your signals to have an urge, and then just go have a bowel movement. So once you've mastered this and you can hold it for 60 seconds, then they said to hold it on, to try sitting on the toilet for 5 to 10 minutes. I don't know who has 5 to 10 minutes to sit on the toilet. On this piece of paper, when I first got it, it said 10 minutes. My husband definitely sits on the toilet for 10 minutes. But I got things to do and I got kids screaming at me and patients waiting on me and all the things. So I changed it to 5 because I feel like if things are rushing out of us, no one would know if we just sat there for 5 minutes. But remember, you are on the toilet and your pants are down, and so you are safe. I want to encourage that the toilet be a safe place, and this does not have to be always so scary. So once you're able to delay this for 5 minutes sitting on the toilet, then you can move this further and further from the toilet. So sitting on the edge of the tub, looking at the toilet and holding on. It says 5 to 10. I like 1 to 5. 1 to 2, I don't know. Set a timer. I like that they said that remember to bring in a watch. Like bring in your watch, set the timer, so that way you can go whenever you need to go. And if you need to do 5 quick contractions to continue to allow the bowels and the smooth muscle to hold that poop, then do that as well. And so then once you are able to delay for 5 to 10 minutes while sitting off the toilet, move further away, your goal should be able to be 5 to 10 minutes away from the toilet. You get the urge, you're washing your hands, you're washing dishes, you're like, okay, I can wait, because that's a little more close to normal. I'd have to say that most people, when I meet them, if they're experiencing this issue, most people that don't have a severe anatomical deficit, like severe prolapse or severe tear after a baby, or anything neuromuscularly going on, stroke, brain injury, that within a month or 2, they are able to do this. It's frustrating to wait a month or 2, but there's a lot going on in that month or 2. During that month, we're strengthening up the pelvic floor, we're retraining some reflexes that have been dead for a while, getting some oomph, some beefiness to the anus, retraining what it feels like to actually have the urge. There's a lot going on in this, and I find that a month is worth spending that time on you. So gradually you can increase the distance and the time away, and both you and your sphincter exercises will benefit from this program. And the sooner you are likely to succeed, the sooner you start going with these things. So quick contractions, looking at the toilet, trying not to go to the bathroom, kind of like Pavlov's dog. So if you keep going, if you get the urge, go, get the urge, go, get the urge, go, then it is a disservice to you, because we get hungry and we don't run and get something from the pantry immediately, and we get thirsty and we look around and we look for our water. We make a mental note: whenever I find that water, I'm going to drink it. And that's what you're trying to recreate with your body, is reminding you that you're in control. This is your life, and and you are in charge of your bowels. So I hope to remember you are fearfully and wonderfully made.